Thank you so much, Dr. Jamali, for taking the time out through your busy schedule to join me today from Bangalore. It's my absolute pleasure to have you, and we are hoping to get some informative answers going forward for the next half an hour. As I
Okay.
already introduced you, but I would like to introduce Dr. Jamali once again for those who are joining in. He is the Chief Cardiac Surgeon and Chairman of the Hospital Executive Council at the Fortis Hospitals in Bangalore. But please don't just go by that designation. He has a huge list of achievements, including the fact that, he has performed more than 30,000 surgeries. That kind of experience can only really tell us what's going on with us Indians, what's going on with our young Indians as we speak about, cardiac issues, heart attacks in young Indians. Dr. Jamali, the last week or so, everybody was a bit shocked with that actor, Sidharth Shukla, succumbing to a heart attack. But really, is it as recent as that? Do we need to delve back several years to understand that this problem has been brewing amongst the young Indians for a while now?
Yeah, you see, I'm in cardiac surgery just now from 1984 or 82, actually, to be precise. And this was not the picture in the beginning. We are now seeing in the last 2 decades or so, a rise in the younger. If you look at the statistics, the stats in India, we really don't have reliable stats from the government, and it's all in patchy private bodies. So myocardial infarction or heart attacks in young individuals in India, very less data and not sure. But in South Asians overall, it is roughly felt, the entire South Asia is about 5 to 10% of the heart attacks happen in individuals who are much younger. And in other ethnicities, if you see among the whites, the blacks, and the Arabs, it's about 1 or 2% of the whole population. And more solid data, if you see from the Western world, there is a big study called the Framingham study, very famous. And this study showed 10 years of follow-up, and they were studying actually the hypertension, but they showed that per 1,000 men, the incidence was 12.9, 30.2, and 70.2 of all the heart attacks, 1,000 heart attacks in different ages. And in women, the age groups, there was almost more or less little same, but a slight edge with the women. The reasons for this are pretty clear, that our lifestyle in India has completely gone for a toss. For hundreds of years, bit by bit, we perfected certain lifestyle about our work, about our food. Every 200 miles you travel in India, you have regional food, but it's very balanced. You come to my region, the north of Karnataka, Gulbarga. We have a certain cuisine, but it is so perfect. And now it's all gone. You go to Rajasthan, they used to have certain food, but the Rajasthanis moved to Bombay, and what they eat is not the same. And so we destroyed our lifestyle, our working pattern. Smoking has come in, especially in females. The family histories have changed. A lot of dyslipidemias, cholesterol, triglyceride pattern because of eating had changed. These are very common risk factors. And if you have to study the youngsters, there is something called as the apolipoproteins. And if you check the apolipoprotein B divided by the apolipoprotein A1 ratio, if it is more than 4.35, there's a very high prevalence that they could have a heart attack. And a lot of these youngsters also have higher level of homocysteine. And if you see that the inflammatory markers like CRP are high, then your suspicion would go higher. In the females, low estrogen levels, females who have been taking oral contraceptives, they are a bit higher prone for all this. And then there is a pandemic of obesity. Obesity we can define by the body mass index. Body mass index is your height, your weight in kilogram divided by your height in meters. And if it is higher body mass index, more than 30, it's almost 42% of our urban young Indians are having a higher body mass index. All these people are more prone now. In my practice, I see more and more youngsters coming for bypass surgeries, coming for stents, coming with heart attacks in the CCUs. And also this business about unregulated gymming. You know, you go to the gym and almost 80% of your gym trainers are not really well knowledged and the best. And that is one. Then this pushing up supplement, which has become a huge business vertical. And we don't know how many guys of them for getting proper chiseled body, this 8-pack, 6-packs are on anabolic steroids. All these things could get into that. And then with this rising of Taliban in Afghan, we know that more cocaine is going to flow here, more marijuana is going to flow here, and drug abuse is also a rising threat for causing coronary artery spasm and all these kind of, the unusual reasons to have heart attacks in younger people. And so also now in all the major cities, we have possibility of gene sequencing. And if you sequence genes and you find certain particular genes in the youngsters, you can predict much early that they may be falling prey for this. And all these individuals would start showing in their first decade itself certain cells called foam cells in the intima of the arteries. And that would end up in fatty streaks. That's the beginning. And by third decade or second decade, later half, you will see actual plaques formed with the cholesterol inside and a cover outside. These plaques, they may not be severe, but they are very unstable. They are very flimsy, and the friction by the blood flowing on them, all the grainy substances in the blood flowing on them, can many times rip open very easily a thinner cover of these plaques. If it rip opens, the lava from inside comes out, forms a thrombus, forms a clot, and people who were not showing any positivity on a treadmill or any symptoms may suddenly come with a heart attack. And that's the picture inside. Also today, you must understand we are in a pandemic. And you know what COVID does? You get a COVID and you have a very low kind of illness. You are just little flu and you're not bothered. You see the doctor, you did RT-PCR, RT-PCR is positive, they say go into quarantine. Most of the people will duck from doing any further test. You must do the test. You must do your inflammatory markers, your CRP, your D-dimer. If the inflammatory markers show high, that means there is cytokine in your body. If the cytokine is rising in your body, you will develop clotting in your body. And you can develop clots in your heart arteries, your brain arteries. You could get heart attacks and strokes. And if you have markers positive, you must go on anticoagulation medicine. And the anticoagulation medicine should go on for 6 weeks. If that is not done, a lot of these people will suddenly come with a heart attack or suddenly drop dead at home. And we hear this story again and again during this pandemic. That's the science behind it. So a lot of people, even many doctors in the Mofussil areas don't understand that inflammatory markers are high. You must give them anticoagulants for 6 to 8 weeks. So these are all different causes of why these problems happening in the younger individuals.
Is it true? Sorry, Doc, to interrupt you. Is it true that these issues are emerging almost a decade earlier amongst Indians as it is, in the Western world?
Maybe more. It's true. We understand two things, that there are two solid studies, ethnicity-wise. There's a guy who's actually from my city, St. John's College, who is in UCLA, Salim Yusuf. He has done a very elegant study on epidemiology of heart disease in United States, because United States is a cauldron of ethnicities. And the South Asians suffer highest with heart attacks. And their coronary disease is more pernicious. Their outcomes are worse. And the women also have a bad kind of a deal. The same study was repeated again by another guy called Ines in another university. And in this, we also see that more Indians are coming much faster, more younger, and more of them have left main involvement and also more diffuse involvement. All this is a bad news. In India, if you see with the Indians that come early in their age, we see different pathophysiology, different problems happening on the angiograms or what is happening inside is 80% of them are like their elderly counterpart, the conventional atherosclerotic risk factors and disease, same like the older ones. 4% of them have a congenital by birth malformation. 5% of them have clotting happening somewhere because of coagulopathies, etc., or even rhythm disturbances or a small hole in the heart, and the emboli will come from somewhere else and go in the coronary arteries. About another 5% of them have clotting disorders and coagulopathies, and there will be spontaneous clotting happening in the body, and they may need to go on anticoagulation drugs all life. And about 6% of them, especially these guys who indulge in drug, can have spasm of the arteries. And it could be caused by inflammation, radiations, but some of the females may have fibromuscular dysplasias and both females and males, but more in females, and it can have a spontaneous tear of the coronary artery from inside, what we call as dissection. But again, I will draw a little underline on this COVID business, the gymming, excessive gymming, and the supplements.
So how is our inside different from the elder one? Is it just the drugs and the gymming, or there is more to it?
As I told you, 80% of them are just like the older ones, but they're just coming early. And their coming early is probably a lifestyle problem. And lifestyle, we know that both for adults and for youngsters, our lifestyle has gone for a toss. Our stress, our pollutions, what we eat today. Look at what we eat today. Everything is processed. Even the fruit juices and the pizza. Suppose a small pizza. The pizza made at home, homemade pizza, and pizza that you eat in a hotel is completely different. And every drink that we have is loaded with sugar. Processed sugar is a very risky proposition. So today's lifestyle for youngsters, their stress level, their pattern of living, everything has changed. And so it's not a wonder. But then why in India? Why not abroad? Why not in the Western world? There is something genetically different in us. And that's why the South Asians are more prone for heart attacks, more prone for atherosclerosis. The same thing gets mirrored and passed on to the youngsters. So younger people, both male and female, are paying a bad price today.
So genetics has a big role to play, is it?
Definitely. And today we are in a position, at least in the urban areas, or even the rural people can go and get that facility and come back, get their genes sequenced, and we could get an early warning, definitely. And there is
So
a
what about,
definite
sorry,
incident, hypertension and diabetes.
hypertension and diabetes? Yes, of course, diabetes is huge in our country as well. What about the silent heart attacks that we're hearing about so often now?
Silent heart attack is a heart attack where you don't get pain, don't get that classical symptoms. And that is not uncommon. Actually, it was always there. Today, because of diabetes, it is more common. And can be dangerous because the alarm system of the nature is muffled. And then you would drop your BP, you may get into heart failure, you may miss that golden window of that 1 to 3 hours where you could get a thrombolysis done, a stenting done. So that's the danger of a silent heart attack. And people may just come with a diarrhea, may come with a nausea, may come with all kind of vague symptoms. Only a smart doctor with a higher suspicion index could take an ECG and you will come to know.
So, to the layman, what would you say as the first, port of call? What is to be done immediately if they suspect it's happening at home?
You must have a higher degree of suspicion that I am uncomfortable. I may have a heart problem. The first thing is ECG. And the first thing is, of course, instead of wasting time at home, go to a nearby hospital, or there are hotlines for every hospital now. Call the hospital and they will quickly send you ambulance. It will save you a lot of time. In the ambulance come smart paraclinicals. The paramedics can take your ECG. There are now kits where your even troponin T enzymes can be done at home, and those the blood test can be immediately diagnostic. So diagnosis can become made very early. And if you are nearer to a major hospital where there's a cath lab, and if you are okay to get an emergency angio and angioplasty done, that's the perfect answer because the muscles can be saved 100% if done in time. If no, then you can be given the clot dissolving medicines in the ambulance itself. If you are far away, if you are in a different unreachable area, or if the traffic is bad, if there's a congestion. So paramedics and ambulance is a good idea.
A lot of people say keep an aspirin at home. Does that really work?
Yes and no. But nothing like getting a help. I mean, you just can't get a help, then all this would come in the picture.
Right.
And aspirin anyway you must take, because if you are to get an invasive thing done, you have to be made ready with aspirin. So taking aspirin is a smart idea. 375 milligram aspirin, you take it stat. Any which way it will help you.
Okay. And what about management then?
Also the statins.
The
That
statin.
was statin.
Yeah, so
Yeah.
there's a lot of controversy about statins, Doc. Would you like to clear that up?
See, all over the social media, there is so much of fake news going on that the statins have been given, statins don't take it. No, no,
Yeah.
no. Absolutely not. Anybody who has a coronary artery disease, especially if you're undergone a procedure, a bypass surgery, or a stent, statin is a must. And also those who have blocks which are not tight, but the blocks which are soft, which may become very unstable easily. The statins make them hard, make them stable, bring down the possibility of a heart attack very dramatically. If you have undergone a bypass surgery, if you have a stent inside, the incidences of stent failure, the graft failure, newer blocks proliferating, all this would be very successfully and dramatically brought down by proper dose of statins and blood thinners. They are a must.
So, yeah, of course, there are also the guidelines for, as you were mentioning to me earlier as well, for stents and
So,
bypass surgery. Is that
uh,
something as well that you come across a lot of ambivalence when it comes to that?
come again?
Oh, about stents and bypass surgery, is there a lot of ambivalence
Okay,
in the way,
fine. There is a lot. I know all over the world this debate goes on because there's a huge industry behind the stents. And wherever you see an industry lobbying, it can even lobby in the scientific literature. So this controversy is quite high from almost last 3 decades when it's since the stents have come in the market. Today, if we can't boast that we know the whole truth, but we can definitely boast that a part of the truth is very well known to us. And there are very pakka, clear guidelines. The United States, the AHA and ACC, American Heart Association and American College of Cardiology. Go to Google, you can find out these guidelines. The European guidelines, the Credo Kyoto guidelines in Japan. These are all very solid, trustworthy guidelines. And all these guidelines say that if you have a coronary artery disease in all the three arteries, and the disease is severe, you are a candidate who will do well and who will not come back again and again for repeat procedures, especially if you are not covered by insurance by bypass surgery. If you put multiple stents like that, your chances of getting multiple repeat procedures is high. But sometimes there is a big possibility that if the left front artery has a block and the stent fails precipitously, you could die. So triple vessel disease, which is severe, especially associated with some amount of weaker heart, the left ventricular dysfunction, bypass surgery. If there's a left main coronary artery disease, and that disease is a little more complex, it has to be a bypass surgery. And any major vascular disease in the coronary arteries, which seems to be quite complex, badly calcific, long branches arising from it, any block can be stented today. Anything we can drill, there's no problem. But the midterm and long-term outcomes will be very unfavorable. And in all these cases, bypass surgery is more favorable. Nobody wants a bypass surgery because your chest is going to be open, you are going to be operated upon. So it's very easy option, very attractive option to get stenting done. But no, if you have got multiple stents done and later you come for a bypass surgery, your bypass surgery outcomes may be a little inferior than if it was done fresh. So this controversy is fairly elegantly answered today. And so it might be a good idea for somebody who needs that to take two opinions from a surgeon and a cardiologist and then take an informed decision.
Fair enough. How do we look at both short-term and long-term rehabilitation of people who've suffered?
Yeah, once upon a time, rehabilitation program did not exist, even in big hospitals. Today, we all realize in all branches of medical science, rehabilitation is a very important tool. And if you are talking about post-bypass surgery, post-heart attack, post-stenting, especially if the ventricle is not good, post-heart transplant, I think cardiac rehabilitation programs today are on a very solid footing, solid foundation, and they definitely make a difference to a patient the way they go back into mainstream of life. So I think rehabilitation program are important in every major hospital, and rehabilitation program, though little bit an extra cost, are worth for the patient. And today, for starting from COVID, for everything, we have online rehabilitation programs, and somebody can handhold you at your home online.
So before I take a couple of questions that have come for you, Doc, I want to ask you to tell us your top three pointers for how we can prevent this in the young.
Yeah, you see, prevention. Today, every year we celebrate World Heart Day. World Heart Day was started by the World Heart Federation in 1997. The motive of doing celebrating World Heart Day is to create awareness that heart attacks can be prevented. And from 1997, it was decided that by 2025, we must reduce the deaths by heart attacks in the world at least by 25%. Every year, 1.7 crore people die across the world by heart attacks. Now recently, I think it is almost touching 2 crores. This year, the slogan of the World Heart Day is to use digital health to recognize, to prevent, and to manage heart attacks. How do you prevent? That's a very low-hanging fruit. Eat healthy. Today we know that every commercial eating that we do is dangerous. Today we have information at a click of your mouse. Go to Google and ask what is unhealthy eating, and you will come to know. Eat healthy. Secondly, get active. Though today all the gadgets have made us very lazy. No, at least a 30-40 minutes walk every day would change things dramatically. Third, stay at a healthy weight. Obesity is an epidemic. Fourth, quit smoking, quit smoking, quit smoking. There is no more doubt left. All the froth is gone. And also stay away from secondary smoking. You are in the Diwali Jagran and all are smoking and you're not smoking, you are going to end up smoking a pack by morning. Fifth, control your cholesterol and blood pressures. So better to get tested. Blood pressure testing is very simple. Everybody's home has got a blood pressure apparatus. And check your lipid profile. Check your apolipoprotein if you are young. And make sure that you are not in that category. Number 6, drink alcohol only in moderation. That means 1 or 2 peg in a week, or not more than a glass of wine. Red wine is better. Manage your stress. The stress has become such a big hangama. If you look at Mr. Manmohan Singh, who had such a bad problem, and he faced a job which was probably the worst job of this country. Look at how he is. And look at his timer, the president of the United States, who underwent a bypass surgery. Look how he looks today and how Manmohan Singh ji looks today. So stress is not in your job. Stress is in your attitude. Manage your stress. And there are so many different strokes for different folks. How do you manage your stress? But if you do these 7 things, you can avoid almost 80% of your heart attacks. 80%. And that is why this awareness. Also, you must understand that women today, their incidence is rising. If you look at this young heart attack patients, the proportion of women among them is almost 25%, and 75% are males. There is something called as MINOCA, myocardial infarction without much symptoms, and that is much higher in women. And there is also a higher incidence of smoking in women, and they must understand the wake-up call. These challenges are also because they have a very atypical and delayed presentation of their heart attack. And they also, compared to male, have more non-adherence to the treatment strategies. And also in the rural and the secondary India, there is a bit of a negligence of taking women in time to the hospital. So all these things are resulting in we seeing that the women are, and whatever we thought once upon a time, that the post-menopause, we had, that menopause was a protection, estrogen was a protection till then. That also today is thinning out. So, that also awareness must spread among women in the especially urban areas.
Right.
But on the positive side, we have a lot of tools to treat. We can take care of anybody who can come in time to us, however bad the problem may be. But that's a positive side.
We always need the positives.
But prevention is possible to a large extent.
Yes, And that is, I think, is the vital point to remember. Doc, can you hear me? Okay, so I'll just take a couple of questions. There's Rina who's asking you, have you noticed an increase in heart attacks during this COVID? Does it have more to do with the sedentary lifestyle? Doctor, can you hear me? I think we have lost him, but I'll just try and be patient and see if we can get this back. Otherwise, I do think we've covered, it's been very informative session. I think we've covered how we can prevent. We've figured out how, why the young are getting it, what is causing it, and really the most important thing, that it can be prevented. And, going forward, if we just remember the 7 points that he's given us, I am going to wait for just a moment to see if he does come back. If not, I think it's been an informative session. I think we've almost gone to half an hour as it is, which is the duration for my show. But yes, he is here. Okay. Let me see if there's a connection. Okay. Can you hear me, doctor?
Yes, of course I can hear you. Can you hear me?
I can, absolutely. So there was a question for you, asking you if you've seen an increase in heart issues during COVID.
Yeah, I explained you just now. COVID is a risky proposition. We have been learning every day. We have learned quite a whole deal. COVID, if there is a cytokine rise and there is inflammation inside, the major pathology is it will create clotting. And the lung, pneumonia in the lung is not like normal pneumonia. It is actually like a gangrene of the lung. There is a thrombosis, clotting of all these small venules and arterioles, and there will be a damage which is very difficult to reverse. Same way, clotting can happen in the heart arteries, and that can give rise to a heart attack. There was a leading gastroenterologist in Bangalore, very healthy man, all the time on golf course, well-known, very fit man, had a COVID illness, which was very mild COVID illness. So he quarantined, took those basic drugs, no anticoagulation, recovered. 20-25 days later, morning, he was found dead in his bedroom. And there is no doubt that it was the left front artery, the left anterior descending coronary artery thrombosis, which led to a large heart attack. So it's important to do inflammatory markers in the beginning of the course of the disease. If they're positive, you must be on 6 to 8 weeks of anticoagulation drugs. Then you can avoid everything.
Doctor, there's a message for you from Indonesia, from a medical doctor who's hoping he can be a student doctor to you. And
sure.
Is the change in the circadian rhythm an outcome of internet lifestyle in today's young? Does that tip the balance?
It's everything, the food, the physical laziness, the lack of sleep. The list goes on and on. All the modern evils. Of course, sleep is also very important.
Lack of sleep. Yeah, somebody's asked about the impact of lack of sleep on heart attack.
Absolutely. It can. All these modern urban evils, as I told you, the food, the lack of physical exercise, the smoking, the drugs, lack of sleep, stress, all these 5 things. And also not testing yourself. You have a family history, you don't have a family history. If you have a family history, you should wake up early. The party can be over early. And you must start checking yourself. Am I developing diabetes? Am I developing hypertension? Am I developing coronary artery disease? You have a nice warning by the destiny that because your father had, your mother had.
What are the tests for... Sorry. What are the tests for detecting markers of potential heart problems?
Clinically, without testing, just the family history. Then if you are obese, if you think I'm not doing exercises, if you think my food habits are bad, that itself is a solid common sense marker. Then in the test, as I told you, apolipoprotein, the
Yeah, that's
homocysteine,
right.
inflammatory markers like CRP, and then of course a higher degree of suspicion that if I've got diabetes already early, I've got hypertension early, I'm not managing them well. All these are wake-up calls. And I told you the
Which,
apolipoprotein B
yeah.
and apolipoprotein A1 ratio, your basal, I mean your obesity index. All these are markers.
Okay. I think I've got to let the doctor go. It's been a half an hour. I'll just take that last question. What would your advice to gym
Sure.
owners and, you know, those people who are fanatic about gymming be?
The gym is a new epidemic in India. We always did exercise right from hundreds of years, all those warriors in the past. But it was in a very different way. I mean, exercise is a science, and there are enough physiotherapists who will teach you correctly. But there is nothing wrong in doing simple exercise at home, and even the floor exercise that we do at home can tighten your core very well. It's a combination of food and exercise. Your fat, your flab will not go by exercise. It's food, food, food. So food,
Yes.
there is a very basic thing that, all this new kind of understanding that your intermittent fasting is one of the major lessons that we have learned, that if you're fat, go on intermittent fasting, you can lose your weight very fast. Then you got to sculpt yourself. You got to build your muscle mass. So you must understand that I must have enough protein intake, but not these supplements which could be of doubtful value, proper natural proteins. And the simple exercise at home, simple floor exercises, a cardiac exercise by walk or a jog, then simple exercises, dividing them among all the muscles, even keeping weights at home. You can always take an advice and you can build up your portfolio of exercises at home. And there is really no need to be going overboard on that. But the worst thing is this supplement business. One has to be very careful, read carefully, understand do you really need these supplements or not. God has provided so much on your platter of food. And
Yes.
Google
Very
is,
crucial. Very, very important.
and
Yes. And
all
Google is
information is at a click. You know, Mr. Google of yesterday is Mr. Google today. It gives you at
yes.
one click everything that you want.
Yeah. Or maybe you don't want, as you mentioned, the supplements. That's another fad, isn't it, Doc? Everybody's just
Yeah,
popping in the
that's the
supplements,
word,
you know.
the fad.
Yeah. No, this has been an extremely informative session. I will let you go now, Dr. Jamali, and hope to
Thank
get
you.
you again on this session. But
Sure.
thank you so much for laying this out for everybody in very simple terms. And I
My
think we
pleasure.
know what we have to do.
Thank
But
you,
thank
Lucy.
you so much for joining
Thank
me.
you. My
And thank you,
pleasure.
everyone else, for joining me.
Thank you.